Dr. Chamri, if you are in the waiting room.
Dr. Sugat, I am not the co-host. I can't see.
Okay.
Yes, okay now.
Good morning, good afternoon, good evening to the veterinarian from the different region in the world. You are welcome to Sri Lanka Veterinary Association second international webinar series. We have organized 16 webinars at the second SLVA international webinar series. Our resource persons are well-reputed veterinarian in Sri Lanka, USA, United Kingdom, and Australia. Our topic is feline clinic and problem-based approach. Our resource person, Dr. Yushika Dharmasuriya, founder, Zootopia Animal Hospital, is happy to conduct a wonderful webinar. I would like to request from you all to subscribe to SLVA YouTube channel and click the bell icon to receive the notifications. Without wasting much time, I would like to invite Dr. Suhanta Malavarachi, the President of Sri Lanka Veterinary Association, to welcome you all. Dear President, over to you.
Thank you, Dr. Sugat Ramachandra, our immediate past secretary. And very warm welcome to everyone for this international webinar series, third session. Actually, I must wish very happy Vesak today because it is a 2566 celebration of Vesak. And today, the meaning of Vesak is to spread the peace, harmony, and the kindness among human and animals. So that is for the Buddhist, and also I hope that it is valid for all the religion. And to start with today's session, I welcome you all as the President of Sri Lanka Veterinary Association, especially the Sri Lankan Veterinary Association members. And I can see most of Indian Veterinary Association members also joining, including the President. You all are welcome, very warmly welcome to this session. And I'm happy that most of our veterinarians are keen on updating knowledge, because we have shared this among all the veterinarians to update their knowledge. We know that knowledge update is very important, though we have basic understanding about all these subjects. Actually, it's like keeping a new cloth in a wardrobe, because if you have knowledge not updated, then like a cloth, when you keep in a wardrobe, when you take it later, you can really wear it, but only thing is it is not updated. So likewise, we need to update our knowledge and also share. That is our objective of this session. Actually, I am very happy that Dr. Yushika Dharmasuriya, she is our Assistant Secretary of Sri Lanka Veterinary Association, is volunteered to do this session, feline clinic and problem-based approach. And I hope it would have been much better if it is a physical session, but due to the present constraints and difficulties, we are obliged to go for virtual session. And this is a ground rule, that is to keep your mic muted to not to disturb the session. And I really happy that all of you are on time. Thankful and also grateful to all the members who spend their time on this holiday, and really appreciate your presence here. So without taking much time, I invite our today moderator, Dr. Nuwan Wickramasinghe. He is immediate past treasurer. And Dr. Nuwan, over to you.
Thank you, Dr. Malavarachi, and good day all you. I'm really happy to moderate this session. Yushika is, first of all, give the microphone to Yushika. I would like to give the brief introduction about her. She's a past Vishakian. She graduated from our university. It means the one and only veterinary faculty in Sri Lanka, University of Peradeniya, 2014. Just after the passing out, she has joined to the one of the very famous veterinary, small animal veterinary hospital in Sri Lanka. It is Rover Hospital. She worked there 3 to 4 years. Then she started her own practice and very famous practice in Sri Lankan situation right now, Zootopia Vet Clinic. And she has been working for past 7 years for the small animal practice very well. And she's one of the member in the SCAP as well. She in 2020, after starting the Zootopia Vet Clinic, she is more dedicated to the veterinary cardiology, where veterinary feline medicine and the veterinary pathology. She has published many research articles in the locally as well as internationally about those subjects. In addition to that, she is consecutive 2 years Sri Lanka Veterinary Association committee member. In this year, she is holding the assistant treasurer, assistant secretary post as well. With this introduction, I would like to hand over the audience to the Dr. Yushika for her session.
Thank you very much, Dr. Niwan, for the introduction. And I would like to thank Sri Lanka Veterinary Association in giving me this opportunity. So it's really exciting to address the professional community. Thank you all for joining in with my webinar. So I'm going to be talking to you about the feline clinic and problem-based approach. So before starting the presentation, I would like to give you the outline. First of all, I want to talk to you about the client psychology and the feline clinic. This is mainly because as veterinarians, we want to know our statistics. So if you analyze your statistics, you might know that there are dog cases, like doggy cases are really high, canine cases. But when it comes to feline cases, it's not as much. And we mainly receive felines in the latter stage of their disease. So we have to know the statistics because we are losing economically if we don't focus on the client psychology. And specifically, we are going to lose the income if we don't tackle it right. So there is a study which is done in Canada, mainly about our clients, feline clients. So they have shown that only as half as many cats receive annual exams as dogs. So this is a big number we are losing. So there were 2 problems which was identified. So to tell you, these clients are well read and they know about the feline diseases very well. So even though they have faced these problems, cat owners are mainly anticipating unpleasant experiences at veterinary clinics. So as you all know, it's really hard to handle cats more than the doggies we handle in our clinic. So 58 of the cat owners, they have told that they hate visiting the veterinarian, even though they are facing an issue. And 38 of the owners were stressed out about thinking, going to the veterinary clinic. So this is as half as the vet cases we are receiving. And the problem number 2 was that 81% of these clientele, they thought that their cats are independent and self-sufficient creatures, that they require very minimal attention. 81% of the clientele also thought that their cat was in perfect health and they had no issues which they wanted to go to the veterinarian too. 53% thought that the cat has never been sick. So 63% of the population thought that their cat was so self-sufficient that they never wanted to go to the vet, and they weren't aware about the illnesses they could be facing with their cat. So the cat clinic concept has to come into action because we are losing around 50% of our clients because we are not focusing on how to tackle the issue. So why do we want to bother as a veterinarian? So implement the cat clinic concept will reduce the stress of the cat. Thereby, the owners will be really happy to come to you rather than hesitating to come to your clinic. Then you'll be having more visits to your clinic. On the other hand, are you ready to receive a cat attack like this? If you train your staff and your veterinarians, fellow veterinarians, into handling a cat in a proper environment in the proper way, you'll be having a happy consultation as you see in the pictures. For an example, I have tried when I was very young to take a blood sample from a cat, and 4 people have been hauled in the cat and we could not take the blood sample. But after taking the cat into a very calm room, I alone could take the blood sample from the jugular vein without the cat being very arrogant. So how do we achieve the expectation of a happy cat and a happy client? So we have to have a happy client, a cooperative patient. Specifically, we have to have a proper cat with us, not to make the clinical parameters being altered when we are diagnosing the disease. Most importantly, we are going to have a happy staff and a less stressful staff and a veterinarian while working. How do we make a happy place to your patient and the client? Starting from the waiting area. So you have to have, this is not very expensive solutions which I'm providing, and the blinds, the separators to separate dogs. As you are seeing in this picture, so there is a fish tank in between. It's not a huge wall, but the cat won't be seeing the dog. The next concept is you are keeping separate areas to sit. So as you are seeing in the second picture, you just have to place another blind cupboard to keep the cats and the dogs separated. Also, have a platform to keep the cat cages. The cats would not like to be on the ground area. So if you can provide with a small cupboard like in the third picture, so your clients can really place their cats on the top of the cage, on the top of the cupboard. So which is making the cat less stressful before we do the clinical examination. Or you can have a separate cat waiting and a cat dog waiting area as a room, so which is going to be more efficient. Then I'm going to focus the examination room and the treatment area, how we are going to place these areas. First of all, a cat should have a warm, non-slip surface. So as you are seeing in the picture, you can place a towel, a clean towel on the top of your table. Specifically in Sri Lanka, I've seen, and I'm using stainless steel tables, which is very slippery and very cold. So the moment we keep our pets on these tables, they get agitated. And also the client gets agitated. So then we won't be able to handle the cat properly. Next thing is having some treats or rewards. I know it's kind of expensive, but it's very easy if we keep these tiny little treats with us. So the cats and the dogs and both of these species will be really helpful and they have a happy experience in your clinic. So they will be looking forward to come to your clinic. So by that, you reduce the stress of the cat. And tell owners how to interact with the cat, not to scream, not to drag the cat, or not to take the cat out of the willingness from the cage. So it is very important how you guide them through the experience. You have to always keep the necessary equipment in your place. You can't run about when a cat is in the room. And opening the doors, closing the doors will be a bigger distraction to the cat, which makes them stressed out. So you have to have always, for an example, have the cotton pieces, have the blood collectors and blood collecting tubes before collecting a blood sample. So you have to have, it's better if you can invest on a separate cat area where you can place all the materials in one place. Again, avoid exposure to other animals. And it's always best to find the quietest area in your clinic when you're handling these cats. How do you prepare your clients for the visits? It's really important how to guide your client when to come next. First of all, tell them how to seek attention in the issues they see in their pet. You have to specifically tell what sort of changes you have to be ready to be seen with your patient. Behavioral issues are one major issue which we can focus our clients to. For an example, if a cat is littering outside the tray, it could be a sign of a major health issue. So you have to let the client know that these are the behavioral changes which we have to focus at home. So they will know that the cat needs help of a veterinarian and the health issues. Start with kitten consultations. Always have nutritional consultations. Tell the client how to give the nutrition for a young cat. For example, you have to give 50% of animal proteins for the kitten in their growing state. And you have to always tell them how to give these proteins, select the proteins to prevent further health issues like having diarrhea. And you have to always have the monitoring of weight of the pet. Even a 5% differentiation of a cat's weight is a very specific clinical sign for a disease which may be in the system of the cat. And always have a timeline for vaccinations, deworming, and tell them how to come, when and how to come again. By that, you will have a proper impression in the client, and you can give them a proper idea about when to come back. By that, in other words, you can increase the amount of consultations you have in your clinic. Always provide with leaflets and reading materials. If a client is really interested in their pet, they will always read the guiding material you'll be sending to them. But you don't have to really worry about it because it's always available over the internet. You have to use the reliable sources like ISFM, American Association of Feline Practitioners. So they have the leaflets which are ready for the clients to read. The more you know and how you present your knowledge to the client is really important. That's how you build up the confidence with the client. So when you do this, when you connect with the client for this ride of adopting a pet, they will always come back to you when they face a problem. And with the increased amount of usage of technology, try to be available while working via the internet, WhatsApp, and those media, because nowadays clients tend to use those media to be easily communicate with their veterinarian. So these are the guidelines which you can find over the internet in the American Association of Feline Medicine and ISFM. So you can find these reading materials and give it to your client. Next, I'm going to focus on the routine screening tests and wellness programs, which we can have with a cat. Based on their age, you can put up these life stage guidelines in your clinic. You can give nutritional supports, do the screening tests, advice based on the life stages of the cat. Tell them what to know, what changes they can expect with the adulthood of the cat, seniority of the cat, how to change their diet. So I'm going to focus on the American Association of Feline Practitioners guidelines based on the life stage. So when it comes to the disease conditions, kittens up to 1 year, you can focus on the genetic conditions, infectious diseases, and dermatophytosis skin conditions. When it comes to 1 to 6 years, always focus on the bronchial diseases, cardiac issues, enteropathies, urine issues, dermatitis issues. You can focus on whether the cat is having fleas, whether the cat is having lice. Most of the patients which I'm seeing, Himalayans and Persians, they have lice issues. You have to treat accordingly. You have to advise them accordingly. When it comes to a mature cat, always focus on the kidney diseases, enteropathies, hypothyroidism, which is commonly available, diabetes mellitus, neoplasia, cognitive dysfunction, degenerative joint disease, and periodontal diseases. Medical history. So there has to be a guideline for you to focus on each life stage. Always discuss on the breed healthcare predisposition when it comes to a kitten. So in Sri Lanka, we have several of the breeds, but nowadays people are importing Maine Coons. For an example, they have genes for hypertrophic cardiac myopathy. So you have to let the client know what sort of tests you will be suggesting for each of these pets. And the young adult, ask about the vomiting, hairballs, and diarrheic issues they have. and the grooming habits and the behavioral changes. An adult, I would be focusing on medical history, polyuria, polydipsia. You have to let the client know that these are the changes you'll be seeing in the cat. And ask about the mobility issues, vision issues, grooming habits, and check and ask about the masses in the body. For example, in a degenerative joint disease cat will be having less mobility than often. And examination, focus attention on physical examination. Discuss infectious diseases in a kitten. What sort of infectious diseases and what sort of vaccines you can give to prevent the diseases. In Sri Lanka, we have tri-cat vaccination and anti-rabies vaccination, which we can use on these cats. And when it comes to young adults, increase focus on the cardiac, respiratory, dermatological functions and oral health. As Dr. Chandika must have mentioned yesterday, there's wide variety of dental issues when it comes to oral health. So we have to focus on how to tackle these issues with the client and talk to them about dental cleanups. Again, in mature adults, you can force oral examinations, ophthalmic examinations, thyroid gland, kidney issues, and conduct pain assessment when it comes to osteoarthritis issues in the cat. Elimination, always discuss how to set up litter boxes, how many litter boxes and how to clean their litter boxes and the scented litter they should choose or unscented litter they should choose. And in a young adult, when it comes to a growth amount of the cat, they might have to increase the size of the litter tray. Again, mature adult, we have to talk about where they have placed most of these litter boxes, because with osteoarthritis, some cats may not be able to access their litter box. Again, on the oral health, always examine a young cat's mouth for malocclusions, dental issues, and tell them how to do the teeth brushing and cleaning of the mouth. Always recommend a dental diet, maybe in a young adult, if it's necessary. In a mature adult, above 7 years, you have to focus on the oral tumors, open up the mouth and check all these issues. Always go for parasite controls every once in 3 months. It's really important to give the parasitic medication because tapeworm and roundworm issues are immense in most of the cats. And it's important that we communicate these conditions to the clients because tapeworms, most of the species, they are zoonotic. So we have to, as veterinarians, focus on all those issues. So when it comes to a young cat, so there are routine tests we can perform. You can use this as a guide. So we be checking pro-BNP or echocardiograms because 15% of the population are prone to most of the cardiac diseases genetically. Identifying these issues as their family veterinarian, knowing your cat will prevent you to have sudden deaths because of these issues. Full blood counts, blood smears, UFR and chemistry will be the suggested tests which we can perform in a young cat. This could be done every year or every 6 months if the client is up with spending the amount you are suggesting. Screening tests for the geriatric patients. Hypothyroidism, to check hypothyroidism, we have to check thyroxine, SDMA, pro-BNP, full blood count, serum chemistries, urine tests, they have urine infections, and mainly blood pressure. You have to have a Doppler blood pressure monitor in your clinic. You have to invest on it because mainly when it comes to high blood pressure, there are damages which is counted in almost all the cats when it comes to their organs damage. So next thing, I'm going to talk about the problem-based approach of feline diseases. So my guideline will be first, identification and thinking patterns. Then I'll be focusing on 3 main common signs we'll be seeing in many of our patients who's coming to our clinic. Firstly, I would like to talk about the problem-based approach. So you have to always create a problem list based on the clinical signs you are seeing in these patients. How do we create the problem list? You have to get the history from your client. For example, if you ask from the client, he will say that the cat will be having frequent small amount of diarrhea always. And then another client will come with a dehydrated pet. When you ask the question, does the cat have diarrhea? He will say, no, he doesn't have diarrhea. He's just not well. But the next question you have to ask, I encourage you to ask this question always. Where does the cat eliminate? Have you seen the poop? Have you seen the defecated parts? What is the color? Most of the clients, 50% of the clients would say the cat is defecating outside. So then you have to again ask the question, is the client saying the truth? Sometimes you have to be more observative when it comes to collecting these facts. Then you have to define the problem list. Do we have any other signs which is interfering with the identified problem? The cat may be a little bit jaundiced. You are seeing a yellowish mucous membrane in the cat, so which needs further clarification. So there can be more than one problem with regarding the cat. Define the system where the problem is involved. So you have to always ask the question, how is the problem involved? So when it comes to frequent defecations and very small amounts, our thinking pattern always goes to large intestine. You have to ask the question, how is the problem is involved with the system? Next thing, we have defined the location that it could be large intestine. So then we have to go with the diagnosis. We have to find the exact diagnosis. You have to define the lesion. So when you're defining the lesion, it could be colitis, parasitism. So you have to collect samples. You have to always go for diagnostics. And this gives us a clear idea rather than screaming for help. Now, when it comes to the problem list, you have to ask the question, is the cat really vomiting? Or is the cat regurgitating? Or is it a reflux? So you have to ask the questions, what color is the vomitus? Whether there is any bile in the vomitus. Is it diarrhea? Is it anal gland secretions or secretions from the genital area? It could be an abscess which is ruptured in the anal area. It could be a wound in the anus. So is it absolutely diarrhea or is it any other problem? So you have to do your clinical examination with patients and do it right. The client may say that the blood is there in urine. You have to always ask the question, is it coming with feces or is it from the genital area? So sample collecting and examination will help you guide through these conditions. Is it blood cells or is it hemoglobin or is it myoglobin? Always do the evaluation based on these questions. So you won't miss anything with regarding the cat. The client may say, my cat is constipated, because it's the most sensible answer they could have when a cat is straining on the litter tray. It could be urinary obstruction, because the cat may strain in the same way when they are having a urinary obstruction. It could be colitis. The cat may be feeling irritation in the large intestine, or it could be constipation. It could be, now the client will say that the cat is seizing. Now you have to ask the question, whether it's seizures, cardiac syncope, or whether the cat has fainted due to hypovolemia. Maybe you can ask the client to take a video next time they see these patients seizing. So you can have a proper idea about what the cat is facing. And always locate the pain. Is it cranial abdominal pain? Is it caudal abdominal pain? When it comes to defining the system, I'll take an example to explain you how to define the system properly. We see a loss of balance or weakness in most of the cats. Now, this could be a structural problem, neurological or skeletal. So it could be primary structural problems. So you have to do the nerve examinations, muscular examinations, and it also could be secondary issues. It could be a problem in the heart that it's not functioning properly, anemia or hypoglycemia. So these are the secondary issues which we have to look for as contributing factors. Now, how are these secondary systems involved? As an example, so some of the cats, they have low serum potassium in their system. They may be having neck flexion and general debility in their system. So what could be the involved systems? It could be GI system, that diarrhea is causing potassium losses. It could be renal issues, metabolic alkalosis, hypomagnesemia, diuresis, or high aldosterone. Now, how is this system involved again? But because sodium and potassium is needed for action membrane potentials in skeletal muscles, the cat is having debility in the system. So the cat is having loss of balance and weakness. So that is exactly why we have to always think about the other ways rather than the primary problem. So if you don't focus on these issues, rather than looking into the exact proper issue, you won't be able to focus on the proper system to treat. Defining the location and the lesion. Is it central nervous system? Is it an injury? Or is it damage to vestibular nuclei? Is it otitis? Is it otitis or neuritis? Secondary issues, vomiting, diarrhea, or hypoglycemia due to sepsis. Now, when it comes to pathology outside the systems, you have to locate and identify the lesion. Now, I'm going to focus on the common issues we see in cats in the three main areas I have described to you before. First, I would take a dehydrated cat. 50% of the cases which is coming into our clinic is a dehydrated cat, which we see more than 8% or 10% dehydration. So there can be a wide variety of reasons. Rather than just giving some antibiotics or just giving fluids, we have to always address the primary issues. You have to give the fluid therapy in the correct way. You have to put a cannula to these cats. It's with the practice, it is an easy task. So you have to make yourself practice to putting in a cannula and supply bolus if it's needed, or slow IV if it's needed. So when it comes to a dehydrated cat, there can be many reasons. So I'm going to focus on 4 main reasons to start up with. Reduced water intake. So this could be due to pain in the mouth. Gingivitis, stomatitis conditions could be one main issue, that the cat is not eating or not taking any water. Loss of appetite due to other systemic illnesses, hepatic issues, urinary tract infections, parasitemia, calci or herpes viruses. So because of these viruses, the sneezing cat, they won't be able to smell their food. So most of these cats smell their food, and that's how they have the appetite rather than a dog. The visual stimuli is not enough for a cat. Next is loss of fluids due to diarrhea and vomiting. Loss of concentrating ability on urine. So therefore, they are losing more water, even though they take enough water to their system. This could be due to kidney failure. Losses to body cavities, massive hemorrhages. So we have to evaluate the reasons very efficiently and very fast. So I'm going to take the first reason, reduced intake of fluids. So in the first picture, you're seeing a severe gingivitis condition in the cat. So as Dr. Chandika must have told yesterday, there are many dental issues which we have to focus in day-to-day visualization of the diseases in the mouth of the cat. The second picture shows the our callus is pushing against the gingiva of the cat and causing a huge pain. So according to the problems we are seeing, we have to go with dental cleanups, effurcation and dental cavity issues are seen, you have to go with dental extractions or complete mouth dental extraction if you find chronic gingiostomatitis in cats. Even if after dental extractions, if you are seeing the problem, you can go with steroid therapy only when you diagnose the condition right. Again, pale mucous membranes, if you are seeing this problem in a dehydrated cat, you have to ask the question whether it's anemia or is it poor peripheral perfusion. CRT measurement can give you a proper idea if you don't have the other diagnostics in your clinic. So why do we see anemia? So tick fever conditions are very common in Sri Lanka and in other countries. Immune-mediated hemolytic anemia is other reason. Refeeding syndrome, which is very commonly seen, which we miss. Paracetamol toxicity, thiamine deficiencies are main reasons of anemia. When it comes to perfusion, poor perfusion, it could be dehydration and hypovolemic shock, cardiac issues, or circulatory disturbances. Talk about fever and pale mucous membranes. You have to definitely have a microscope, at least in your clinic, to go through these slides. Take a blood drop, stain it, and look under the microscope. So in the first picture, it's very rarely seen cytopzoonosis in Sri Lankan context, in Sri Lankan cats. It's a very deadly disease. Second, you can see this is Babesia in the second picture. So when you identify Babesia or these conditions, there are several treatment protocols. And there's filaria. Even with a blood drop, you can diagnose filaria, which is very, very common among cats. And then hematobartonellosis, excessive hematobartonellosis in these cells in the last picture, you can diagnose this condition. When you're treating these conditions, our treatment of choice will be oxytetracyclines. When we are giving oral oxytetracyclines instead of injections, always advise the client how to tackle the issues with regarding gastric refluxes, gastritis, gastric esophagitis, because if the cat is not eating with the oral medications, you have to advise them to come back as soon as possible to get IV medications, IV support. Otherwise, they will end up having severe gastritis. You will be too late to treat if a gastric ulcer causes them to bleed. Next, for IMHA, we can perform Coombs tests. We don't have to have sophisticated items to perform this test. You can have your microscope. You only need another slide, cover slip, EDTA blood, and a drop of saline. So when you put it under the microscope, you can see that the first picture is having extreme agglutination. So once you see this picture, you are so sure that it's IMHA, which is causing the cat to have depleted blood in the system. In the second picture, not so much of agglutination, but mild agglutination there, but we call it again IMHA. Roller formation, we won't be counting it as IMHA. So when it comes to cats and dogs, you can see some of roller formation when it comes to a wet mouth. So you can treat it accordingly to increase the amount of blood. Again, you have to focus on the Heinz bodies and micro RBCs. This is something we really miss. But when you focus on these pictures, which is rounded by the green circles, you can see that there's a snout coming out of the RBCs. Sometimes you may see micro RBCs, parts of RBCs in your blood smear. So you have to always ask the question why you are seeing this. Now, this is contributing for hemolysis, IV hemolysis. So it could be oxidative damage to RBCs due to other problems. It could be paracetamol toxicity. When you see this, you can go back to the client and ask, have you given paracetamol? So out of 2 out of 10 clients may say that they have given because they are not aware that the paracetamol is causing toxicities. So if you find this reason, you have to then and there give acetylcysteine IV in the correct dose to get the problem out of the system to prevent the further aggravation of the issue. Next is refeeding syndrome. We see this commonly in our clinics, but we don't identify the problem mainly because most of our clients are not able to afford electrolyte panels. But when it comes to a cat who's not been eating for a few days and started eating again, may go for severe anemia within hours of time. It's because of the insulin surge they get with the food, and it causes hypophosphatemia due to increased intake of phosphorus into the cells. It causes fragile RBCs and micro RBCs, which is giving severe acute anemia. This is a deadly cause, which we have to identify, correct the electrolytes if it's possible, give phosphorus or magnesium. So you have to identify these issues before it's too late. So it's the key that you can evaluate your blood smear properly and thoroughly. Next, I'll be taking increased loss of fluids due to diarrhea and vomiting. So I'll be taking vomiting as the first cause. It could be primary diseases of the gut. If it's a stricture formation or a primary structural problem, you can do surgical treatments after discussing with your client. If it's a medical issue, a functional issue, you can do the medical management. Or it could be secondary issues like liver, kidney, and metabolic issues, which you have to identify and address. Next is diarrhea and vomiting. So in the first picture, you can see a reddish anus of the cat. So even though your client says that the cat may not be having diarrhea, you can do your examination starting from tail to mouth. So if it's a reddish anus, this could be due to anal glands, or this could be due to chronic diarrhea. In the second picture, you are seeing that there is a very wet, pasted anal area. So when you are seeing this picture, even though the client might say that there's no diarrhea, you have to understand that the cat is having diarrhea. So the general clinical examination is the key here. Third picture, you can see a wound at the side of the anus. A client may say, my cat is having diarrhea, yellowish diarrhea. But when you're examining, it may be a ruptured abscess at the side of the anus. So it's not diarrhea. If you treat for diarrhea without looking properly, you might miss the diagnosis. Next thing, there are many causes for diarrhea and vomiting. Main cause which we have diagnosed is feline panleukopenia. And then you have to do the proper clinical examinations and diagnosis, which we'll be talking in the next few slides. Next thing is bacterial enteritis. Always perform a blood smear, which is very cheap. And you can see whether there's leukocytosis. If you can't see whether there's leukocytosis or not, you can go for a full blood count after discussing with the client. So you can start an antibiotic therapy if you suspect if it's bacterial enteritis. And it could be pancreatitis. And it could be IBD or enteric lymphoma, which is very common among cats. So to start with, we'll go with feline panleukopenia. So how do we identify the feline panleukopenia? This is a very fatal and highly contagious disease. Mortality rates are really high. And the mortality is due to septicemia, due to suppression of the immunity because of leukopenia they are facing. Spread is due with orophycal route, and the virus is abundant with saliva and feces. And the cat can shed the virus up to 6 weeks after recovery. It's really important that you understand the pathophysiology and how the cat spreads the disease to prevent any more cats getting this disease. So if your cat is tri-cat vaccinated, then maybe you can eliminate, if it's properly vaccinated, you can eliminate this diagnosis because it gives a proper coverage when you give the tri-cat vaccine every year. Usual way of diagnosis is, because looking at the clinical signs, the cat is depressed, anorexic, having fever, or vomiting, maybe watery to bloody diarrhea with distinctive odor and severe dehydration. Now, the problem with just looking at the clinical signs, it could be chronic colitis that the cat is having bloody diarrhea, or it could be bacterial enteritis. Dehydration could be due to other problems. Fever could be due to other issues, as we discussed, maybe tick fever. Vomiting also could be secondary issues. So how do we conventionally diagnose? How did we conventionally diagnose this issue? By looking at a full blood count, by looking at pancytopenia. But there are other issues like septicemia due to bacterial infections, which is causing the blood cells to deplete because of the iron deficiencies and because of left shift of the leukocytogram. So you have to do the proper diagnosis. And why is it important? So there are commercially available test kits, which is not that expensive. So you can use those test kits to diagnose it properly. So it will give you the diagnosis in 10 minutes, which is very accurate. So even though other diseases are there, which is causing to have the same clinical signs, you can really do the specific treatments if you diagnose it right. Late presentation, late identification can reduce the recovery rates. So, and also you have to guide your client through these issues. You have to tell the client how many days to come, how many days it will take to recovery. So by that, when you are telling the client and guiding through them, they will build up that confidence with you. So they will know how much of money they have to spend, how many days they have to do the treatments. To control the spread of the disease, always ask the question whether they have other cats and ask them to clean their environment so any other cat would not get the disease. So the canine parvo kits, which is commonly available around, you can use them to diagnose feline parvo. There is a study which is supported, which says that there is a close ancestral association with the virus of CPV and feline panleukopenia. So you can use these test kits to diagnose the disease. So what are the treatments we can use? Broad spectrum antibiotics, IV and subcut fluids. If you want, you can supply, if you have the ability to give amino acids via IV, you can use that. And antiemetics, anti-ulcer medications. And there's a specific medication I want to emphasize at this moment. There's a medication called filgrastim, which supports us to increase the number of neutrophils in the system, thereby to reduce the mortality rates in the cats due to septicemia, due to secondary infections. So vitamin B12 is really important, and erythropoietin every other day is to be given. Now, the main factor I want to emphasize is not to starve these cats. In the previous days, in the old days, we asked the clients not to give food until the cat stops vomiting. But when you do the starvation, it's going to reduce the recovery rates. You have to support them via IV until the vomiting stops. And you have to encourage your client to do assisted feeding, even though they vomit, until the cat eats by itself. So this may go for 2 weeks, 3 weeks. So you have to make the client ready for this rough ride. Next, I want to talk about gastrointestinal lymphoma and IBD. So this is very commonly seen among cats. The clinical signs will be weight loss, vomiting and diarrhea, increased or decreased appetite. So via physical examination, you can really palpate their abdomen. It's easy to palpate the abdomen of the cat than the dog. So you can feel thickened intestines or abdominal masses when it comes to these conditions. So blood work is likely to be normal in these both conditions. So you can go with an ultrasound scan. So most of our veterinary clinics are having ultrasound scans. So you can use this facility to diagnose these conditions. So when it comes to the ultrasound scanning, as you can see in these pictures, the normal intestine is only having mucosal area, which is very thick, but all the other areas are compacted into one little area. But when it comes to T-cell lymphoma or IBD, you can see that the submuscularis layer is very much thickened. So you can have an idea whether this is inflammatory bowel issue or whether this is another intestinal diarrhea. So this is the first clue you get. But we can't stop from there. We have to go with the definitive diagnosis. So we have to take biopsies of the intestinal tract to differentiate T-cell lymphoma from IBD, small cell lymphoma from large cell lymphoma. But in other countries, they do have endoscopic ways of sampling. So if you have that facility, you can use that, which is less likely to cause complicated issues like perforation from the sampling site. Always go with exploratory laparotomy after discussing with your client the reasons of why you have to go for the definitive diagnosis. It's mainly because of the treatment protocols we use, and always you have to explain the client what sort of a lifetime they are looking at in this sick cat. So when it comes to IBD, you can start with a simple medication like sulfasalazine, so which is reducing of the inflammation of the gut. If your client won't agree to go with biopsies, maybe you can do with pre-treatment elimination, but you have to always discuss the client that it's a long-term medications and long-term identification of the problem, that they have to bear that with you if they are not willing to pay the cost for an exploratory laparotomy. So when it comes to small cell lymphoma, the treatment protocol is a steroid therapy and oral chemotherapy. So you have to always regularly monitor, because these drugs can have some side effects. Always you can talk about the survival time after diagnosis. So it is 2 to 4 years. So as I told you, when you give these statistics to your client, then they are in the same page as you are. They have the expectation and the expected outcome, expected lifetime of these cats in their head. So they will be ready for it. And they will know when to come back to do the regular monitoring part. Next is large cell lymphoma, which is very malignant and significant, worse prognosis than small cell lymphoma. And always it is associated with masses in the intestines. And in these cases, surgery may be recommended to remove some of the masses to clear out, or resection, but the prognosis is very poor. Then I'm going to talk about the pancreatitis, the next issue, which we are commonly seeing, but we miss. The signs will be loss of weight, increased appetite. This could be due to EPI, bile acid deficiencies, malabsorption, lymphoma, or IBD as well. So we have to know how to do the diagnosis. So vomiting and diarrhea may be seen. Cranial abdominal pain is the sign we can see. So the diagnosis part. So when we do the chemical analysis, increased amylase and lipase will be seen. And if we want to do the definitive diagnosis, we can do feline pancreatic lipase, which is available in many of the hospitals. You can send the samples there and check for feline pancreatic lipase. So increase in these chemistries, you can always tell that it's pancreatitis. Or if you are a very good person, very good like having skills with ultrasonic examinations, you can identify pancreatitis. Not to discourage you, but it's really hard for most of the people to locate the pancreas. But when you are used to it, when you give your time and get yourself trained, you can find the pancreas. You can see hypoechoic pancreas with hypoechoic mesenteries. You can compare it with surrounding organs. Medical management of acute pancreatitis, you can do fluid therapy for 48 hours. You can give pain medications. Unfortunately, since we don't have much pain medications, we can go with NSAIDs like meloxicam. Antiemetics can be used, and antigastric medications. And monitoring for recurrences has to be done, especially because most of our clients are giving high starchy, high fatty diets to their cats. That's because the main reason we are seeing pancreatitis. So you have to always advise the client how to modify their diet. You can go with modified calorie diets, reduced fat diets. So you can always select the diet and give them a proper plan not to have this disease again. Next, I'm going to talk about increased loss of fluids due to inability to concentrate the urine. So when you're talking about inability to concentrate urine, we always focus on renal failure. So a dehydrated cat, you have to palpate the bladder. You have to always look for the lumbar pain initially and collect a urine sample if you are suspecting renal failure. And if every other reason we have spoken earlier is eliminated. So you have to do the analysis of the urine sample. So how do we collect the urine sample? 80% of the cats, if you properly do the manual expression, you don't have to really worry about doing ultrasonographic guided sampling or catheterization. So when you practice yourself for manual expression, that will be the easiest way. Otherwise, you can do aspiration of the sampling of 22 gauge needle from the bladder. If you're not confident with that technique, you can go with ultrasonographic guided sampling or catheterization. You have to definitely have this equipment in your clinic. I'm telling you that you have to have a refractometer in your clinic. I'll tell you why in the next few slides. You have to check the specific gravity properly in the cat's urine. So again, before going into fluid therapy, if you diagnose renal failure, if you find out that the cat is azotemic, before jumping into fluid therapy and Lasix, you have to always evaluate the pre-renal, renal, and post-renal cases. Always do no more harm. You have to know what the reasons are. Otherwise, you will do more harm than treating the fellow. So when it comes to urine specific gravity, this gives us an idea about the concentrating ability by the renal tubules. So the interpretation of this result can be done with other results when we do the sediment analysis as well. So most of these are affecting the interpretation of urine sediment by the sediment result. So you have to evaluate these properly. How do we do the urine specific gravity interpretation? So in these ranges, which I'm talking to you about, as you are seeing, the usual range starts from 0.035, but we are using dipsticks to check urine specific gravity, which is not efficient at all because it stops at 1.030. So we can't really know whether it's adequate concentration or inadequate concentration. So having the refractometer is one most important thing when it comes to evaluating the specific gravity. So adequate, what do you mean by that? Sufficient functional nephrons are there to prevent development of azithemia in these cats. So if it's falling under inadequate, your specific gravity when a dehydrated cat is there, you can always tell that there's progressive loss of functional nephrons. So inadequate means less than 1.040. And the concentration is compromised when 2/3 of the nephron mass is lost. Isostenuria equal to the specific gravity. So primarily renal azotemia, the kidneys cannot concentrate or dilute the urine. So there is often a fixed constant isotonic urine range, 0.008 to 1.2. However, renal diseases, total loss of renal tubule function occurs gradually. Therefore, between isostenuria and adequate ranges in animals with dehydration, you can be highly suggestive and highly sure that the cat is having primary renal failure. Hypostenuria indicates that the cat is unable to concentrate urine at all. So the total loss of concentrating ability is there. So how do we evaluate the causes before treatment? So one main reason for kidney failure is high blood pressure. So you have to, as I told you, have a proper Doppler machine to check the blood pressure in cats. and you have to train yourself how to do the pressure analysis and to calm the environment, how to use pheromones with cats to calm these cats before doing the pressure evaluation. So again, as I told you, 15% of cat population are to be identified, has been identified to be having cardiac failures, which is one main reason we are seeing in renal failure. So hypertrophic obstructive cardiac myopathy and hypertrophic cardiac myopathy can be diagnosed by proBNP and echocardiographic tests. So the renal causes are CKD, chronic kidney disease, nephritis, and infections. Post-renal causes will be urinary tract infections. So how do we guide ourselves through hypertension? So this is the chart which we can use when there's 150 or more blood pressure systolic BP. We call it borderline hypertensive. So the risk of target organ damage is low, but we have to address it. And all the other hypertension, you have to evaluate the cause of hypertension. Maybe it could be hyperthyroidism. So you have to evaluate that issue as well. So you have to check thyroxine amounts. If the thyroxine is high, you can go with specific medication. And if it's hypertrophic cardiac myopathy, you can treat it accordingly. So how do we diagnose feline hypertrophic cardiac myopathy? Using echocardiography alone can miss some of the feline cardiac myopathies. But if you combine it with proBNP, you will never lose that diagnosis part. But if you're doing proBNP alone, then you will miss more than you are doing the cardiac echocardiogram. So you have to go with both the tests. So which is very important to do because fluid therapy, anesthesia, and steroid therapy can aggravate these hypertrophic cardiac myopathic conditions. And to know before doing a surgery on a cat, it will be easier for you to prevent much of the deaths. So when it comes to the echocardiogram, I'm going to talk to you very simply about what you can see. So there are many veterinarians who perform echocardiography. So concentric thickening of the papillary muscles. So as you see in the first picture, the papillary muscles are very thick. So we don't really see this commonly in other situations. So IV septal thickening. In the red arrow, you can see how thick the muscles are. And left ventricular wall thickening can be seen consecutively. So the specific facts, again, we have to categorize this hypertrophic cardiac myopathy before talking to the client. So if it's between 6 and 6.5, we call it mild hypertrophy. So this is very important. We categorize these areas to severe hypertrophy or mild to tell the client what sort of a timeline we are focusing on about the expectation, life expectancy of the pet. And you can see afterload and systemic obliteration, systolic obliteration in these pictures. So there is no volume in the left ventricle at all. So what are the treatments? So furosemide can be used if we find that there is a fluid overload and dilatation of left atrium. Clopidogrel usage is a must as a long-term protocol to prevent unwanted clots. Diltiazem if necessary, if the blood pressure is high, and if you need to reduce the blood pressure and the contractility. Monitoring is a must to check blood. Monitoring is a must in the future when we diagnose this condition, checking blood pressure, checking wall thicknesses, lactate checkups. SpO2 means partial pressure of oxygen is necessary, whether to give diuretics or not. Liver and kidney parameters has to be monitored accordingly because we are using medications in a long-term basis. So we have to tell the client when to come back and how much monitoring we have to do when it comes to such a condition. So when it comes to CKD, so we have proper guidelines, which is very easier for us, given by IRIS. So there are certain parameters which we have to check when it comes to chronic kidney diseases. So consecutive increase of creatinine or SDMA. And when it comes to kidney imaging, the size of the kidneys in X-rays or the wrinkling of the perirenal area, the renal capsule. You can see the distortion of the anatomy. The distortion of the renal capsule can be seen because of the fibrosis. and UPC measurements consecutive increase. So staging, why is staging important? So as you can see, there are several parameters they have supplied to us. And why is it important? So we have to always talk to the client about the prognosis. So this is how you do this. And always the staging is important rather than prognosis to decide what sort of treatment protocols we can go for. So they have supplied us with proper treatment protocols for stage 1. Use of nephrotoxic drugs to be done with caution. And in you have to check the blood pressure, you have to supply a renal diet. So likewise, in the consecutive stages, there are several ways to do the treatments as they have told us. So you can refer to this document over the internet at any time. Why do we have to look into the sediment analysis? So when it comes to sediment analysis, as you see in the picture, you can see there's a lot of bacteria. And in the second picture to your right-hand side, you can see white crystals and white blood cells. So you know whether it's a post-renal cause, whether it's an infection. So you can treat all, when it comes to urinary tract infections, always perform UFR and sediment analysis. Next thing is culture and ABST. So why do we need culture and ABST? So most of these bacteria which we find in urinary tract infections, we find it with high resistance to most common antibacterials we use. So you have to find the proper antibiotic for the usage to prevent these urinary tract infections. So I'm going for the finishing up from the dehydrated cat. We are going next to the yellow cat, the jaundiced cat. So why is a cat jaundiced? So it could be red blood cell hemolysis in the cat, which we are seeing. As we have discussed priorly, it could be IMHA and other conditions which we have discussed. Or it could be hepatobiliary diseases, which we are going to discuss in the next few slides. So what is hepatobiliary diseases? So when it comes to liver issues with regarding cats, we have primary hepatopathies, hepatic lipidosis, cholangitis. It could be lymphocytic or suppurative. It could be neoplasia. It could be shunts, or it could be toxic issues due to intake of toxins. So we'll take cholangitis first. So it could be primary causes due to idiopathic issues, infectious or inflammatory issues. Secondary issues will be pancreatitis or IBD. Cholangiohepatitis is one major condition we see associated with these yellow cats. We call this strideitis. So how do we get this disease? So mostly, rather than a dog, a cat is having a very short length of the GI system. So because of this issue, the duodenum and pancreas is very much nearby. And because of the infections they face in these GI system, through the audiosphincter, they get these bacteria to the common bile duct, causing cholangitis and pancreatitis and IBD together. So you have to address all these issues to get the cat out of the disease. So what are the causes of this condition? Neutrophilic cholangitis is one main thing which we see, sending infections from the GI system to the liver. How do you differentiate this? So you have to go with fine needle aspirations, ultrasound guided. So you don't have to really be scared of doing these fine needle aspirations. Only thing you have to focus on whether the cat is having the ability of clotting blood. So you can go with clotting tests, clotting time analysis, bleeding time analysis, or APTT, PT analysis before you go for this testing. So if you find any increase in the timing of clotting, you can treat the cat with vitamin K prior to doing the fine needle aspiration. Once you take the sample, you can send for cultures. You can collect gallbladder secretions. So in the fine needle aspiration, if you perform it in your clinic, as you see in the picture, you can see neutrophils and the bacteria are seen. So mostly we may not see the bacteria, but if it's neutrophilic, we can see the neutrophils. So when it comes to lymphocytic cholangitis, it is immune mediated. So biopsy of the liver is again needed. In the second picture, you can see that the lymphocytes are most prominent. Now, why do we have to differentiate these two diseases? Again, one more disease is there, which is causing cholangitis, which is available in Sri Lanka as well, Platinosomum phastosum infections, liver flukes. So you have to do the proper analysis before doing the treatments, because the treatments vary with each condition. So in this, when it comes to ultrasonography, so if you don't have the ability to do the fine needle aspirations, you can at least look into the ultrasonographic images. So this sediment, which is available in gallbladder, is not very common in cats than dogs. In dogs, we can say that there is a sludge available, but in cats, it's very specific for suppurative cholangitis. So you have to take a sample from the gallbladder, send that sample for culture and ABSD. In the second and third picture with the yellow arrow, you can see that the wall thickness is very high. This is another sign of neutrophilic cholangitis. So you can have a clue that it could be bacterial. In the last row of pictures, the left-hand side, you can see polylithiasis due to the stasis of the bile. So that is very common. So if you see this issue, you can either treat the condition or surgically remove these polyliths if it's too big to be removed and if it's causing any obstruction. In the final picture, you can see how the liver is hypoechoic, and you can see it's because of the cholangitis. So you have to increase your ability of diagnosing via ultrasonography as well, because most of our vets, as I know, we do have ultrasonography with us. So use it for the diagnosis, and always you can use a fine needle aspiration of the gallbladder. It won't rupture. It is very safe to do ultrasonographic guided aspiration of the gallbladder. Sometimes you may have to empty the gallbladder depending on the condition. The treatments, neutrophilic cholangitis, you can go with antibiotic therapy, but you have to go far as 1 to 3 months. So these are the antibiotics and the dosages we can use. Lymphocytic cholangitis, on the other hand, we have to use immunosuppressives, prednisolone, chlorambucil, and cyclosporins. Now you can understand why we have to diagnose the two conditions and differentiate. If we give immunosuppressives to a patient with neutrophilic cholangitis, it will aggravate the condition and it won't heal the patient. So with liver flukes, next I'm going to talk about a case which I have found liver flukes in a cat. So the clinical signs were very simple, as sitting aside than in the usual place. It's a behavioral anomaly the client has seen. It was normal food intake the day before, lower appetite, and lower water intake the same day. GCE revealed that there was a very slight amount of jaundice in this cat, very slight yellowish mucous membranes and ears. It had a cranial abdominal pain. So given this jaundice condition, we decided to go for chemistry analysis, which revealed very high amounts of ALT, and total bilirubin was marginal. Ultrasound guided ultrasound abdominal examination revealed that the gallbladder was extremely distended. As you can see right to the gallbladder, the common bile duct was more than 1 centimeter. So it was distended and was suspicious about bile duct obstruction. So we have taken a fine needle aspiration from the gallbladder, and at the same time, we emptied the gallbladder secretions. When we evaluated these gallbladder secretions, we have seen fluke eggs in huge amount of numbers in the sediment. This was Platinosomum phastosum infection. This is a microscopic liver fluke inhabiting in millions in liver and pancreatic parenchyma. It is a silent killer, which we see in cats, blocking the ducts, which may lead to gallbladder rupturing and pancreatitis and severe pain in these patients. So identification, we went for the treatments of praziquantel 20 milligram per kg over 2 weeks, every 2 weeks for 3 months. So this is more than the conventional doses we are using in the every 3 months parasitic control. And the fluid therapy, 48-hour fluid therapy was done in this patient. Antioxidants was necessary. And this includes all the cholangiohepatitic patients. You can start with vitamin E and taurine. Appetite stimulants can be given like mirtazapine. And you can, if you are unable to give these medications to the cat, you can apply mirtazapine at inside of the ear flap of these cats after crushing the tablet. Force feeding or nasogastric tube feeding or esophageal tubing has to be done in these cats to prevent further hepatic lipidosis. Amoxicillin was used in this cat because we have seen bacteria in the sediment and we have got the positive ABSD results. B12 is really important to be given, and the supportive treatments was gone along with the force feeding. A very common condition is hepatic lipidosis of cats. A fat cat being anorexic for more than 3 days, or a normal cat being anorexic for more than 10 to 14 days. It's highly suspicious when the cat is very yellow that it could be hepatic lipidosis. How do we do the diagnosis? We can go for ultrasound sonographic imaging, ultrasonographic guided biopsies. Again, I want to emphasize that you have to focus on the clotting time as well. An analysis of histopathology is very important. So this is a liver of a post-mortem analysis of a cat. So you can see that the liver is infiltrated with fat in the first picture. And picture B, you can see that almost all the hepatocytes are infiltrated with fat globules. So there are very least amount of functional hepatocytes available. So in these pictures, ultrasonographic images, which I have taken from a research article in the web. So ultrasonographic images in the liver and the gallbladder are seen in here, hypoechopic and hepatic parenchyma compared with falciform fat. Increased diffuse ultrasonographic beam. Poor visualization of intrahepatic vessels are seen, so you can't really see the blood vessels very clearly. So in this image, the first image gives us an idea about how do we see the normal hepatocytes. So even if you stain it with Leishman stain, you can have a slightest idea about what sort of a diagnosis you are going for. So in the second image, you can see hepatic lipidosis in a cat. So you can see how bad the situation is. So what do we do for the treatments? So treating the primary cause of anorexia, bacterial infection maybe, we have to treat that condition, and supportive care is very necessary. L-carnitine is one major medication which we can use. 500 milligram per cat. Vitamin E can be used, vitamin C. S-adenosylmethionine is a replacer of GSH in liver to reduce the RBC fragility and reduce the hepatotoxicity damage in these patients. Vitamin K is necessary if the coagulation parameters are affected in these cats. So APTT and PT increase or coagulation time increase, you have to use vitamin K. And ursodeoxycholic acid can be used very cautiously, ruling out the obstructions in the gallbladder. You have to make sure that the obstructions are cleared. NG tube feeding is absolutely necessary if the cats are not eating, but slow initiation is wanted and warranted to reduce the refeeding syndrome occurrence. So 1/3 on the first day and 2/3 on the second day, and the full amount on the third day of energy intake can prevent these issues. And always go for a blood smear to check whether there is RBC fragility. So for the treatments, so as you can see, we can use nasogastric tubes, endotracheal, esophageal tubes for feeding of these cats, so to prevent further aggravation of the disease. Next, I'm going to focus on imbalances and paraplegia of cats. So in this video, we are seeing a very young cat having a very bad imbalance. So we get most of these cases to our clinic. So how do we evaluate this condition? It can be It can't be always a primary reason. As I have discussed before, it could be a neurological reason, a skeletal reason, which we can diagnose with neurological examinations. But I'm going to discuss the secondary reasons here. It could be hypoglycemia due to some infections going on due to sepsis or due to anoxia. So you can check blood glucose to start with. You can immediately start giving IV therapy if there's hypoglycemia in these patients. Liver diseases, pancreatitis, insulinoma are the reasons which we can get hypoglycemia in cats. Dehydration and hypovolemic shock, not enough circulatory volume, can cause a cat to wiggle in the way you have seen before. So what are the main reasons we can see? Hypokalemia due to potassium losses is one main reason we see for a cat to behave in such a way. So history of intermittent diarrhea and food sensitivities or pre-feeding syndrome can be a main clue that you have to look for the potassium imbalances or any other electrolyte imbalances. So you have to correct it then and there to prevent further aggravation of the issues. So no known history of cerebral injury, unexplained recurrences, neck reflection with IBD. So you can always check the electrolytes and do the therapy. So in Basawa manual, we can see how to give the serum potassium levels. It's not a deadly medication to be given IV. You don't have to be scared to use IV potassium. So you can always follow the guidelines and monitor the patient and give it very slowly. And the next reason, in this video, you're seeing ear mites. So there's these wiggly creatures in the video you are seeing. So you can see there's differentiation of the shining material. There are tiny bits of shining moving things in this video. When you're doing otoscopic examination, also you can identify that it is suspicion of ear mites. So you can always take a sample out of that wiggly secretion and look under the microscope. So this is a picture which I have taken and we have seen under the microscope. You have to always treat it with a proper medication. Try not to use injections of ivermectin sometimes if it could be causing a cat to have renal failure. So there are other medications like fipronil and like new products available in the market, which can be used for ear mites as a solution. So try not to use injections directly, but you can use topical applications with ivermectin. So you can use these therapies to control the ear mite condition, which controls the wiggling you have seen. This video I have shown, it is this cat. So it was ear mites. So after proper treatments, the cat was totally normal. And then there can be bacterial or fungal ear infections. So microscopic evaluation and staining of earwax samples is necessary. So when it comes to staining the earwax sample and looking into it, you can see these images. You can see bacteria in the right-hand corner upper picture. So you can do the diagnosis as bacterial otitis externa or fungi in the ear. So in this lower left picture, you can see that there's a lot of fungus. So you have to treat accordingly. So thank you all very much. So this is the presentation I had for you. Thank you for joining in. And if you have any questions at all, you can forward to me via this contact number or the email. I'll do my best to support you in any way I can with your cases. Thank you. Over to you, Dr. Nuwan.
Thank you, Dr. Yushika. Very nice and interesting presentation with the very simple language and with your clinical knowledge as well as the personal experience. I hope most of the small animal veterinarian in this forum will have the same questions, same problem and the same customer base, especially in the cat lovers, very common among all of us. So with that background, I would like to invite to the audience, please raise your questions for further clarification.
So there is a question, Doctor, by Dr. Disnaker. So he has asked this question from us, how to prevent these highly infectious diseases. So I would like to answer to that question while you formulate your questions for me. So specifically when it comes to vaccinations of a healthy cat, you can always have a separate table in your clinic for vaccinations of new animals. And it's not enough. Sometimes these new animals may have these infectious diseases. So you have to always have a solution of bleaching with you to prevent parvovirus of canines and feline panleukopenia spreading of felines. So 34 parts per million solution will help you. So you have to apply that solution on your table, keep it for 10 minutes and wash it out. So by that way, you can kill these viruses. No other way of preventing the disease. So there are other chemicals like CL4, but it's not commonly available. But it's the cheapest item you can buy from hardware stores or from an Arpico to go for the chlorine solutions and bleaching material. So it's the best way to prevent this spread of the diseases.
Dr. Yushika, I have a question. For the newborn kittens, what sort of milk we can give as for their nutrition? If the mother is already died, though there is no milk for the abundant kittens, what sort of nutritional things we can use for their lives?
Well, to start with, we have commercially available milk in the market. So you can always direct them there. So I hope you won't mind mentioning the brands here. So some are specifically made for feline patients. So feline like kitten milk powder is available. So you can always direct them there, even though it's really expensive. So if they can't really afford it, then you can go for conventional methods like the milk powder, but always mention them that it can cause diarrheic issues in these patients. And when you are using the conventional methods, you can expect that the immunity will not be transferred. Most of these kitten milk is having proper antibodies for these diseases. So when we are using the normal milk powder, you won't be getting that coverage. And let them know that they have to keep the kitties secure and always measure the weight of the kittens. When you are giving the amount, you can't tell the client just to give milk. So when you are measuring the kitten's body weight, so depending on the body weight, for 100 grams, you can go with 1.5 milliliters every 2 or 3 hours. If the mother is giving milk also, always measure the weight of the kitten. And if there are low body weight kittens, so they are very prone to die within the first 2 weeks of their life. So they need extra care. So by that, I mean, every 6 hours, you have to encourage the client to give extra milk for these kittens according to their body weight.
My last question, is there any way to train the litter trained cat if they are starting to the litter in outside the litter without any health issues and the kind of the environmental change? One of my client has the problem and I try my best to manage but still fail. It means that they have recently moved to another new house. The other cat is litter trained one. Now he's going to the neighborhood and do the littering. How can we prevent or how can we train to that kind of the cat to the proper way? Do you have any experience or the advices?
Yeah, so this is a very hard thing to do, first of all, because once an adult cat is used to a specific neighborhood or a specific way of eliminating. So I mean, I hope you are not asking about change of like houses. Is it, doctor?
Yes.
Change of houses.
Yeah,
all right.
Yeah.
Okay, so to start with, there are attractive pheromones which you can use, but in Sri Lankan market, but we can't really find those pheromones. But which is commonly available is, what I will always try to use Cupomania, which is a plant like catnip, so which really attracts the cats. So there are litters which is very desirable for cats. So you can always advise your clients to go with different types of litter for each of these cats and see how they respond to it. Or otherwise you can add, the roots of Cupomania or catnip to the litter tray. So they are more attracted to the litter tray. So, and the other main thing they have to do is that they have to keep on using the same litter even though they are in the different neighborhood. So it's a really hard thing to do. It takes a long time. So, but these are the advices which we can give them to attract them to the litter tray, and have always extra litter tray than the number of cats they have in their house. So if, for example, if I have one cat at my place, I have to use 2 litter trays, and make sure that you can take a video. You can ask them to give you a video of where they have placed the litter tray. So if they are placed in the litter tray in a corridor, for an example, they won't use the litter tray if it's a very busy area. So as a veterinarian, if you look into these videos, you will see that if it's a very busy area that the litter tray is placed. So you have to advise the client to keep it in a proper way where they have 2-way access to the litter tray, to come from one side and go from one side. And maybe, place it in a comfortable area, a very not busy area. So these are the tips I have for you. So maybe we can try starting with that. So it's really hard to, get them adapted to a different space. So if it's in the same house, if they want to change the area they are using the litter tray on, so they can move the litter tray little by little, 1 inch at a time, but you can't do it in the 2 different places. So these are the advices I may have.
Thank you, Dr. Yushika. One of the questions from Dr. Kumudu Bandara, he asked about can we use the diluted ivermectin as a ear drop for ear mites?
Yeah, doctor, I think we can use, because we actually have very limited amount of resources in our country and in many of the countries when it comes to India as well. So we have an option of using fipronil. So there's, it is advised to use fipronil in the ear, but there are, of course, doctor, we have diluted ivermectin drops, ear drops available in the market as well. But if you are basically using a very diluted ear drop on a kitten, I advise you to try to use it after they are more than at least 3 to 4 months. So even if we are using the injection, we have to really consider about the age of the pet. So rather than going for the injection, I would rather advise you to use the ivermectin drop if you have no other option. So tick control you can use, of course, or otherwise you can go with the ivermectin drop if you have no other option.
Dr. Yushika.
Yes, doctor.
Thank you very much for the nice presentation. You did the best for us. Thank you very much for that all. My question is, you said for panleukopenia, we can use erythropoietin one another day.
Yes.
Yeah. Normally we use in once in 3 days. So that's why I asked that question.
Yeah. This is the reason, doctor. So if in an ideal situation, so, in proper, if you have a client who can really afford, so we can do the full blood counts every day, but not everybody who can afford are with us. So you can basically evaluate a blood smear, or maybe evaluate, when you are pricking the ear and taking a drop. That's the only conventional method we have if the client is not ready to afford the treatment. So if every other day can be used, that's the most frequent we can use. Even in a renal patient, we can use every other day 100 IU per kg. So unless, mostly because of panleukopenia, the bone marrow is absolutely suppressed, doctor. So every other day usage can really prevent these cats from going to anemia and, thereby panleukopenia. So we can use, it's documented also in research papers, doctor. So you can safely use that dosage every other day.
Okay, thank you, Dr. Yushika. Thank you.
Thank you.
Thank you very much, all. If there is no further question, I would like to invite our secretary, Dr. Chamari Kannangara, to wind up the session with vote of thanks.
Thank you very much, Dr. Nuwan. On behalf of Sri Lanka Veterinary Association, I would like to thank our resource person today, Dr. Yushika, for being with us here today. Thank you, Dr. Yushika, for accepting our invitation to do the presentation. And actually, it's really nice presentation with a lot of colorful slides and very attractive slides. And also you did the presentation in very simple way. So I'm sure all of our audience today must have gained very good knowledge about feline problems. So thank you, Dr. Yushika, again for your very informative presentation. Next, I would like to thank Dr. Nuwan Wickramasinghe, the moderator today, for being here with us and do the moderator work. And thank you very much, Dr. Nuwan. And next, I'd like to thank our president, Dr. Susantha Malavarachi, and our former secretary, Dr. Sugat Premachandra, and all the executive committee members for being here with us today, and also arranging all the webinars and giving their fullest support to conduct this webinar series. Thank you very much. Finally, I would like to thank all the participants today, those who have joined from Sri Lanka, as well as from all over the other countries. Thank you very much for being with us here today. And I also invite them to join for our next webinar. So our next webinar will be held on 20th May, next Friday at 1 o'clock Sri Lanka time. And the topic is parvoviral diarrhea. The webinar will be conducted by Professor Arundika Disanayake. So I welcome and I invite all of you to join our next webinar. One other thing I have to mention, if you have missed any part of this presentation, and also if you have missed the presentation, and also you can tell your friends to watch the webinar later by joining our YouTube channel, Sri Lanka Veterinary Association YouTube channel, or Sri Lanka Veterinary Association Facebook page. So finally, being the Vesak Day today, I wish all of you peace and happiness on this Vesak Day. Thank you very much.